Hello, I'm Dr. Ashani Ratnayake. I'm a consultant anesthetist from Sri Lanka. I'm going to present the findings of our project maintaining surgical services for non-COVID patients in a COVID dedicated hospital, a successful quality improvement project from Central Sri Lanka. My co-workers are Dr. Kosala Somaratne and Dr. Ayeshani Rajapakse. Sri Lanka was also badly affected by COVID-19 pandemic, and we are at our third wave now. And by mid-August, we had more than 350,000 reported cases of COVID-19. Base Hospital Teldeniya, where I work, it used to provide care for more than 1 million population in the central part of Sri Lanka. This area was geographically challenging as it has many mountains around the area, and the transportation is quite challenging to the hospital. But with the onset of COVID-19, after converting this to a COVID-19 hospital, these patients were allocated to another hospital which was located about 24 kilometers away. But because of these transportation problems, a lot of patients were lost to follow-up, and therefore we plan to have the surgical population back in our hospital and doing routine surgical care for these patients. So what we did was we first allocated a 10-bedded area for pre-admission and also for post-operative care, and staff was allocated on a rotational basis, and also staff who cannot work in COVID units due to medical problems were permanently allocated to these wards. And we did surgeries on 3 days per week, and the patients we did surgeries were medically uncomplicated, and we did surgeries on both cancer and non-cancer patients. So these are the results. As you can see, in 2020, we could not do any routine surgeries when there is a surge of COVID-19 admissions. For example, we did not do a single surgery from the end of 2020 October to the start of April 2021 with the peak of COVID-19 admissions. But we started this project in late April, and we could able to keep our surgical numbers more than 30 cases per month, even though we had a very high amount of COVID-19 related admissions. So as a conclusion, maintaining surgical services for the population is important in the time of pandemic, as they're likely to suffer from killer surgical illnesses like cancers more than the SARS-CoV-2 infection itself. So although this project is successful at the moment, with the increasing trend at the moment, frequent assessment and planning is necessary to sustain the services in the face of ever-changing dynamics of the difficult COVID-19 pandemic. These are some of our references, and thank you very much.